The Association of British Dispensing Opticians, ABDO, represents over 6,000 qualified dispensing opticians, advancing the profession and promoting eye health across the UK. Max Halford, who is the clinical lead at ABDO, spoke with us about the importance of primary eye care and the work ABDO is doing to support public eye health.
Max Halford, thank you for joining me. Now, you are the clinical lead at the Association of British Dispensing Opticians. Just tell me exactly, what is a dispensing optician?
So a dispensing optician, there's around about 6,000 of those working mainly in high street practice across the UK. But these are the people that after you've gone in for your sight test at a practice with an optometrist, they'll actually take that prescription, have a look at it, discuss with you your visual needs, and analyse it to make sure that you've actually got the best frame and lens choice for it as well. Around 1,400 of those guys are also further qualified to prescribe contact lenses. So if contact lenses is an option for you, they can fit those contact lenses and prescribe them. And they actually prescribe about the majority of the contact lenses that are used in the UK. On top of that, other dispensing opticians have gained additional qualifications and now getting involved very much in acute eye care, clinical eye care, where they're triaging patients, they're actually dealing with minor and urgent eye care services, and that's helping keeping people out of the hospitals. Probably about 80% of patients with acute eye care can come into high street opticians and avoid having to be sent into A&E. So it just helps our colleagues in the hospitals.
And the career path, you help with the career path?
Yes, yeah, we have various training institutes across the UK. There's various ways of to become qualified as a dispensing optician. We've recently introduced the apprenticeship route, which is a kind of learn as you earn route to take for that. There is also what we call the diploma course, and there's also a full-time study course over 3 years that you can take.
And do you have enough dispensing opticians?
We probably would like to have more. I mean, the more dispensing opticians we have on the high street working, the better it's going to be for our patients, and it'll mean more access to clinical healthcare pathways, more support with low vision, dry eye disease and other conditions that they can be dealt with. And we do hope that the apprenticeship route will certainly attract more people to this as a healthcare career.
And there's been so many advancements in this industry, especially when it comes to technology. How do you help there?
Dispensing opticians have a huge part to play in this. They continue with their study, they do a lot of continuing professional development, and that involves a huge amount of work with the technologies that's available to them. We now have machines on the high street that are equivalent to the hospital type of technology, so we can scan the back of the eye, we can take photographs of the back of the eye. There's many things that dispensing opticians can get involved with, and it's really important because it can have a huge impact on a patient's long-term visual health.
And how is ABDO supporting dispensing opticians?
We support in many ways. In regards to professional development, I guess there's two big strands of work that ABDO does. The first is ensuring that there's the pathways of care that we have for patients are open to dispensing opticians across the UK. And we do have a lot of work in making sure from a policy position to make sure they're open to all of our members, whether you're working in Scotland, Wales, Northern Ireland or in England. Secondly, we do an awful lot of work to make sure that dispensing opticians' qualifications are up to date, making sure that their continual professional development is current. We run a lot of clinical conferences, online training, many forms of training, but just to make sure that people are up to date with all the current technology that's available.
So it's a good career to go into?
It's a brilliant career to get into, and we'd obviously positively encourage people to look at it.
Okay, Max, thank you very much.
Thank you.